Hello, welcome to ComplyPlus Presents. We're here today to discuss another interesting topic in the industry, one that you'll all be aware of and maybe a little bit scared of, and that is statutory and mandatory training. So we're going to go through some of the frequently asked questions, maybe some of the misconceptions of mandatory and statutory training, and also define it, because again I think there's a little bit of a misunderstanding on the definitions and what they relate to. So hopefully over the next 30 minutes we'll be able to cover that. I'm here with Richard again, second time this week, so it's the first time we've done two in a week, but I think we're feeling ready for it.
Yeah, I think it's quite an important topic to talk about, although it seems so obvious. And when you think about how long we've been doing statutory and mandatory training, particularly in health and social care, you would have thought that there's nothing new to talk about.
Yeah.
But you'd be amazed, actually, some of the inquiries that I get from you guys after talking to clients. And I'm thinking, but why do they want to do that? People cannot tell the difference. Sometimes people don't even know whether there's a difference. And again, clarity on what they should be doing and what they end up doing. Sometimes it's quite a lot of work to get people back on track as well if they've been doing things a certain way for many years. And then you are trying to correct that.
Yeah.
Yeah.
And also if they're also being told this is what we need by the people that decide whether they get commissioned or what report they get and so on. So we'll go into some of those examples. So first of all, we'll start with, what is it? We can't really go much further without defining it. So what is statutory and mandatory training? So what is statutory training?
Yep. It's an important question because statutory and mandatory sound the same.
Yeah, they're grouped together a lot.
Yes, they're used as a catch-all anywhere you go, whether it's the NHS, whether it's care homes and dom care companies in a GP practice. People sometimes cannot distinguish between the two. And when I've run face-to-face sessions or we're doing a needs analysis and you ask what looks like a very straightforward question, have you decided what's statutory and what's mandatory? Well, we have a list. Yeah, but on that list, actually, what have you decided you need to do for your business? People don't know that they have to decide what they should be doing for the business based on the needs of their business and the risks within their business. So statutory training is related to the law. So, for example, in the UK, the most obvious one is the Health and Safety at Work Act, 1974, which looks at identifying and minimizing risks within workplaces. So to remain legally compliant, every organization, once you employ people, you set up policies and procedures, you then have to inform people of the risks within the workplace. So what are the hazards? What are the risks within the workplace? And what is the organization doing to mitigate those risks? And what are the responsibilities of the employees, contractors? So it's a statutory requirement. It's not an option.
No.
You have to do health and safety training. You have to do fire safety training, and even first aid, the need for a first aider within an organization, the assessments that you need to make, that's the next part, right? But so statutory training is required by law, and then mandatory training is dependent on the organization's needs. So each organization looks at the services that they're going to offer. For example, if I open a healthcare clinic, I think, okay, what are the risks to my patients? What are the risks to staff? What are the risks to visitors? So what am I going to do about those risks? So what training do I need to provide? For example, resuscitation training. If I'm employing doctors, nurses, physiotherapists, administrators, healthcare assistants, they'll need different levels of training. Some of them need just basic training, level 2, basic life support. But nurses may need immediate life support because they're going to administer drugs, and then they may reverse the causes of a cardiac arrest, and give treatments. Doctors are going to be prescribing treatments. They're going to be maybe doing interventions. They need, at the very least, ILS, but sometimes advanced life support, depending on the setting that they're working in. So it's now up to the organization to do its own needs analysis, organizational needs analysis. What are the gaps? What are the risks? Then do their risk assessments, specific risk assessments, and then come up with ways to mitigate that risk. And that may include training. You have to put policies and procedures. You have to then put training to train people so that they look after themselves, but also ensure that no risk is transferred to service users or visitors or others.
Yeah.
So most mandatory training relates to some law or other as well. There's hardly any course that you're going to do in health and social care that doesn't relate to
some sort of law,
legislation or regulations. So again, this is why sometimes people end up with a list because somebody else is using that list somewhere. Then they say, oh, what are you doing about this? And say, oh, this is my list. Then instead of doing their own needs analysis, they just take the list that they've seen on the internet or somebody has passed to them. And then before you know it, 1,000 organizations are using that list.
Using it. And usually geographical location is another powerful one, isn't it? You go to one county, then the care home up the road are using the same list. So I think, even from my side on the commercial side, you do see a lot of this sort of almost like groupthink. You know, this person's done it and they got excellent, so that must be right.
Exactly.
You also get people doing courses they don't need to do. So I know we talk a lot about, obviously in the news at the moment, we've got things about the NHS, how efficient is it and so on. But I think all across the health and social care spectrum, these efficiencies, time could be saved in these areas and things like that. If people do the right things, understand the difference between, like you say, statutory and mandatory, what do they need to do, what do they maybe not need to do, I think that would go a long way, because we have lots of different examples where,
people are doing pointless training.
People are doing pointless training.
Like doctors being asked to do care certificate. And you think, but why was the care certificate introduced? It was
What is the care certificate?
Under specific circumstances where it was found that people that didn't have prior qualifications in health and social care needed some sort of standardization.
Or introduction.
Doctors already have a degree in medicine and postgraduate certificates, so do nurses. They all they need to do is to do the mandatory and statutory training that is specific to them, based on their roles and
as
responsibilities.
Refreshers
rather than teaching them the basics of health and social care, and then making people do refresher care certificate. I find it really strange. But again, it goes back to the fact that statutory and mandatory training is looked at as a tick box. People don't stop to think, why do I need to do this? They think, okay, we have a list. Has everybody done everything on the list? And I've seen very competent people doing that.
And that is the mindset. I'll be honest, I'd say over 80% of the people that even we deal with, you try and go through a needs analysis. You try and
they've no time for that.
Yeah,
they don't see the point of doing it.
Why are you talking to me about this? Just, I've got a list. Give me the list. If you've got something missing from your list, I'll go somewhere else.
And then the other organizations will just give them everything on the list without any advice at all, no customization at all.
You've asked for this.
But it doesn't guarantee you pass your
of course it doesn't.
CQC inspection or offset inspection. It means that if it has worked for someone, maybe it was appropriate to their organization. Then if you take that list and use it in your organization, you'll probably leave a lot of gaps in your organization because you're using somebody else's.
But I think the other angle there is also to say that, for one, you're almost using someone else's needs analysis, which can never be fully sort of based on your organization's needs. But the other side of it is maybe these outcomes, whether it's a CQC rating or a gold standard certificate, or they've won an award at some sort of ceremony, it could just be actually that they've got good people. Yes. You can't always just say, it's because the training was great. It's not just the training, it's everything else. Training was great. It's maybe the culture in that organisation's good. Maybe the onboarding or induction training was good. But the refresher stuff they're doing is having because it's a tick box. Because I've seen very reputable businesses that some work with us, some have worked with us in the past, and you sort of think, God, what they're asking, and then you see all these great things on the telly or on LinkedIn or how great this organisation is. You sort of think, I'm not sure we could attribute that to necessarily the training, but
funny you say that. I went to when CQC introduced the new single assessment framework. I went to one of these sessions where I just wanted to understand how people were understanding. So I went in as a learner, and I was very honest with the guy. I should have said, look, we run our own company, but we just wanted to understand how you guys perceive this. He said, I'm really happy that you are here because you kept asking me questions about the tech side. What are you doing with the compliance side from the tech side and the training side? And I think we started at 9 a.m. So I was there probably about 8 a.m. having drinks and coffee and all that sort of stuff with people. Then later on in the afternoon, we're having an activity, and I asked to say, look, what's baffling me is all the conversations that we are having. You're talking about the requirements of the single assessment framework. None of you seem to be connecting that with training, the induction training, onboarding training, refresher, statutory and mandatory training. It's a tick box. These are very smart people. They're doing very good work for their organizations. They'll probably pass anyway, but they're not taking advantage of the induction programs and the onboarding and statutory and mandatory training fully, because if you do it properly, it actually covers pretty much all your needs for the single assessment framework. But people are not connecting statutory and mandatory training
to that. They're almost separate bodies in a way.
Yeah.
I think that's the last point I'll touch on this sort of definition side is it's the misinformation. I was speaking with a client of ours the other day. They run a private ambulance service, and that they're being told actually by auditors. I don't know who these auditors are, so I won't be naming anyone, but auditors, so people can make their own minds up about who that is. They're being told that their staff need to do care certificate. These are ambulance staff,
frontline staff,
experienced as well, not newbies. They've been in the industry 10, 15 years, experienced paramedic ambulance staff, and they're being told by an auditor now to do the care certificate.
Maybe we should go and become auditors. What do you think?
Well, yeah, maybe.
Because if you put the name auditor, maybe that could change.
So I think that's the other angle. I think we've touched on this groupthink idea that the company up the road are doing this, so we'll do that. Or what's number one on Google? Let's copy and paste that list and ask for that when we're browsing for our training or browsing for compliance solutions. But I think that's another side that can't be ignored, because a lot of these organisations are reliant on the people governing them to give them the right information. So if there's misinformation there, that's another problem that needs to be talked about and resolved. Yeah,
definitely. Yeah.
Why is it needed? I think we've touched on a few of these concepts already, but from a headline perspective, why do health and social care professionals need this training?
So you need to comply with the law.
Yeah, that's the obvious one. Hopefully everyone got that one already.
Because if you don't comply with the law, then look, you have no business.
No.
You could be done for...
And even as an individual.
As an individual, actually, as a director, you could go to prison, corporate manslaughter, if somebody gets injured or, God forbid, somebody dies. So you need to comply with the law. That's what the law says. But also organizations have responsibilities as part of their registration. If you register with a regulatory body, you are promising that you're going to make the workplace safe for the people working there, including contractors and bank staff, but also your service users, primarily visitors. It's important for reputation, because if you lose your reputation, CQC are going to plaster it on their website to say this organization is unsafe, it's poorly led. They'll probably shut you down, but if you get a poor rating, then it's going to reflect there, and it's a permanent record.
It doesn't disappear.
The reputational damage is another issue. Compliance risk for the organization as well, and motivation as well. Sort of see people are confident that they are safe within the workplace. They're confident that they know what the risks are and they know what to do about that. And patient outcomes as well improve, service user outcomes, because what are we here for? We're supposed people come to us because maybe they've got a condition that needs treatment, or maybe they want rehabilitation or whatever. What are the outcomes like? Responsiveness of the organization, all those things matter. So when you think about the training, there's care quality commission requirements. If there's local authority as well, environmental health, there's health and safety executive, there's professional bodies as well. Your nurse, your doctor, your allied health professionals, part of the requirement for you to stay up to date with your CPD, including statutory and mandatory training. So there are all sorts of benefits. And then mandatory training is customizing it for the organization, which goes back to the conversation we have just had now to say, look, if you take a list from somewhere else and it's not customized to your organization, then that list is pointless. It's just basically like taking policies and procedures for another organization, then you just replace your name. You've not customized them. It's not your policy, because when I come in, for example, as an inspector or auditor, I'll be able to see straight away that this is a document that is just sitting here, nothing to do with your organization whatsoever.
And it's not relevant.
Yeah.
So I think, like you say, touching on actually who decides what training is required, I think that's a really interesting point, because I don't know, what the conception is out there, but you don't actually hear people when they come to us and say, I've been told to do this. I've been told by whom though? By whom would be I think maybe even a survey we could even run.
Yeah. Well, one interesting thing is that some of the good organizations, though, like some of our best clients, came to us before they even hired a single person. Or
Yes.
they've got 2-3 people
They're
in the
in the
room, and they're
startup
saying, look,
mode, yeah.
we're about to start. We need help to do a needs analysis. We need help to come up with a training matrix. What staff groups do you have? Then you do the needs analysis. And those guys comply. Some of them have even got CQC outstanding rating because they've
and the
done
business
things
is growing,
properly.
yeah.
Business keeps growing, and they keep adapting their needs analysis as they grow.
Yeah.
But obviously, it doesn't happen with everyone. People cut corners, and they get registered. And once they get registered, they just chuck everything away and then just start running the business.
Let's start making money.
Forget
basically,
everything
yeah.
that they've promised to do.
Yeah. So we know now what it is. We know who decides it, who needs it. So how is it delivered? Because obviously since COVID, there's been a lot of, again, I think misinformation or misconceptions about how do we do our mandatory training if I'm a business owner or if I'm even an individual? What is the delivery and what are the different methods available now?
This used to be a bit of a hazy area for many years.
Yes.
Until 2013, when the Skills for Health core skills training framework was put in place. So the idea with that framework was to standardize how training is done, because a lot of agency workers, bank workers, people that are floating between different organizations, if they do training in one organization, is it going to be fit for purpose in another organization?
In another organization, yeah.
Right. Which again, the issues around there. But what they did clarify was, suggestions on how training should be delivered. For example, moving and handling basic life support. They've got a theory element and a practical element. So we need to make sure that we cover both.
Yeah.
People can do the theory online, then they come for practical assessments where they're given, we do demonstrations and maybe people are given simulated training, role playing, things like that. So moving and handling, resuscitation, aspects of fire safety, to some extent, infection prevention and control as well. We saw that with COVID, people need to be taught how to wash their hands correctly. People need to be taught how to put PPE on correctly. I remember when I was a student, we did that, but actually whenever we did our refresher training, just assume that you remember how to do that. But I think it's important to do that, to increase that, to increase the frequency of reminding people how they should be doing it. There are some courses, for example, like health and safety, fire safety. Once you do them first time around, then you don't, fire safety, I think they now want it done annual refresher because you do the fire safety risk assessments. But a lot of the courses can be refreshed every 3 years.
Yeah.
For example, equality and diversity, even elements of infection prevention and control, and safeguarding. But it doesn't mean that you wait for 3 years to deliver training or you wait for the year to deliver training. If there's a serious adverse event,
Of course, yeah. You have to act.
you have to act.
And be seen to be acting
And
as well, yeah.
if it means then that you are updating the policies and procedures and training people, then that is part of your recovery plan.
Yes.
Say, look, we've done a root cause analysis. We know that perhaps people made a drug error because they were not aware of the dangers of this particular drug or combination of drugs, or maybe they didn't check with the next person, it wasn't countersigned, then it means you need to retrain people.
Yeah.
So people need induction training, good induction training that covers the core statutory and mandatory training courses.
Yes.
Everything needs to be done ideally within the first 3 months of employment.
Yeah.
Or some of them may take up to a year to finish, depending on the kind of work that people are doing. Then the refresher for resuscitation, moving and handling, fire safety. I think it keeps changing because if you look at the framework, for example, NHS frameworks for agency workers, they demand that everybody does certain training annually. But then when you go to the same NHS trust where the agency workers are working, some of them are doing the refresher every 3 years.
Every 3 years, yeah.
So there's a bit of a mismatch.
Consistency needed,
between
really,
commissioners and host organizations. And then also unscrupulous businesses that want people to do training annually when there's no need for it.
Yeah, so again,
but because then they can hold that client and scare them. And we know who we're talking about here. We're not going to mention names, but there's a tendency that organizations then determine what training people should do. It should be determined based on the needs of the organizations.
Yeah, not
If I
the
go
other way
back to the
round.
NHS and I go into training here in Coventry, I can use the same training in London or Southampton or Northumbria, wherever I go, because NHS trusts the standardization now should be portable to move my training from one organization to the other. Of course, I'll need induction training in every organization that I go
Of course, because
so that I know the local
have to
policies
get
and
around
procedures.
the building and the
Yeah, so
policies
it's
are,
lack of
procedures are.
understanding. It's lack of understanding. If people actually took a breath and said, look, what do we need to do?
Yeah.
What does the law require us to do? What are the CQC regulations and how do they apply to us? What do we need to make sure that we are safe? Then you do your needs analysis. What do we need to make sure that we are responsive? What do we need to make sure that we are effective? It's literally going through. It's pretty straightforward, but people don't take time to do that.
No, makes sense. So, yeah, induction training versus refresher. Okay, so I know you've touched on induction training a little bit there, but what is the difference between induction training and refresher training?
So to come again.
So we've touched on induction training already. So what would we say the key differences are between induction training and refresher training? I think we've sort of explained it in the last segment.
We have,
but,
yeah. But the key there is to say, I could be a nurse or a doctor working in another NHS trust. When I join a different NHS trust, I'll go and do their induction training.
Yes.
So there's what they call, say, corporate induction, where you're learning about the organization.
Yeah.
And usually the CEO comes and says hello to everyone. The health and safety officer talks to people about risks peculiar to the organization. We talk about health and well-being, quality and diversity, and then we go then and do the specific induction for that particular job
Yes.
in that particular department.
Yes.
Then there's the onboarding element because, yes, I know how to do this. I'm trained to do this. I've done that in another organization, but how do I do it here?
Yeah.
What are the policies and procedures here? Then the refresher now is usually a year later. You're doing your first batch of refreshers. Yeah, we know that you know what you're doing, you're not familiar with the organization, but we're just refreshing your knowledge because these are the areas of the highest risk. For example, resuscitation and moving and handling, manual handling. And then every 3 years, we do a refresher for the other courses. So refresher is to top up the knowledge. Has there been changes in legislation or regulations? Has there been risks, incidents or accidents happened within the organization that we can learn from so that we minimize the risk going forward?
Yes.
So refresher, top up the knowledge, top up on legislation and regulations, any changes in professional practice or best practice recommendations. Yeah.
Okay. So the final point I wanted to touch on was, if I'm a professional and I'm having to sort my own sort of mandatory and statutory training out, or if I'm a business owner and I need to go and source this training once I've done my needs analysis, or maybe even I need support with my needs analysis, but we're at that point of saying, right, we need to get something in. How do you assess the quality of providers and organisations offering this type of service?
Yeah. I mean, there are a lot of providers now.
Oh, yes, there are.
Anyone with a laptop and internet connection can set up a website and start offering training. And so the key is to you do your due diligence, look at the organization.
Yes.
There are a lot of individuals who provide fantastic training. They don't necessarily run a big business, but they're individual trainers, local contractors who do a fantastic job. But you need to check actually that they have the credentials to be able to deliver that training. They have the right qualifications. Look at references as well. Google, Trustpilot, FIFO, and others. But actually, you can also ask references from other people that have used their service.
Yeah.
For example, yeah.
Look at case study,
look at the quality of the materials, training materials, and look at the accreditation. Are they accredited? And some people I know ask, are you accredited by the Care Quality Commission? No, the Care Quality Commission does not accredit training.
No.
What they do is they come up with regulations that you need to follow. Then it's up to you now to find.
And they inspect,
Yeah. So accrediting bodies, there are quite a few around now, but I guess the main ones are the CPD Certification Service and the CPD Standards Office. There are a few more that have mushroomed over the years, but some of them actually their credentials are doubtful.
Yes.
But obviously, if you want qualifications like emergency first aid at work, and other qualifications, you have to check that they are OFCO approved
Yes.
qualifications.
Slightly different.
And
to
they are
CPD,
actually
yeah.
offered through a legitimate awarding body, because I've seen organizations that look like awarding bodies, and if you didn't know better, you'd think that's an awarding body, but they are not.
But they're not, yeah.
Then when you take that training, you are bringing a lot of risk into your organization, and even your insurance providers may actually not cover you.
Not cover you if something goes
I've seen many
wrong, yeah.
organizations that said, look, you do realize that your insurance company won't pay if anything goes wrong because you have not done your due diligence properly. So it's really crucial. And I think we've written a blog even about how to select an e-learning provider, how to choose a mandatory training provider. But again, organizations, it's going back again to say, look, governance is crucial. The governance framework that you have for your organization, what are the compliance requirements, who's responsible for what, hire people that will help you with the quality assurance, hire people that will help you with the needs analysis. If you have the skills, by all means do it internally. But if you cut corners and just get the cheapest person,
Yeah.
then
the most local,
you're
or
taking
whatever
also
the
quite a lot
convenience
of
is.
risk that way. Yeah.
Yeah, yeah. So I think some really good points there on how you can select a provider to support you with this. So I think we've already touched on the accreditations, but what accreditations are required for statutory and mandatory training? What are the 2 or 3 things to look out for?
If you're doing healthcare, if you're providing healthcare services, then the main framework that we follow is the core skills training framework.
Yeah, from Skills for
which
Health.
was developed by Skills for Health. It's got its own issues, let's be honest, because if we were to follow that ourselves, some elements of that core skills training framework are outdated.
Yeah,
So
even
for
as of today.
Yes, so you'd need to look at the latest legislation. You need to look at Resuscitation Council guidelines. There's so much that is involved in ensuring that the training is meeting the required standard. If you follow the core skills training framework alone, you'd fail some certain elements of your CQC inspection. But it's a good guide to start with. But I think they need to invest more in actually keeping it up to date. Like now, actually, the latest version was done in 2021 during COVID.
And now we're in 2025, yeah.
And how many laws have changed since, how many regulations. So it's hard to trust it fully.
Yes.
Right. The Skills for Care, I've seen they've updated the requirements, and it was quite comprehensive before. Now it's got it's more refined in some way, but it's also missing crucial bits. Okay. And if you were to follow it, you'd miss quite a lot.
Yeah.
So there's an element then of needing accrediting bodies, a robust peer review system for content developers and trainers, but also accrediting bodies and awarding bodies. Training is poorly regulated. Let's face it. We've been in the industry for many years. We talked
about training regulators in a previous episode, didn't we?
Yes, it's poorly regulated. That is the truth. We try our best to self-regulate and come up with all these systems. We hire quality assurers, we hire subject matter experts, we have a research and development team to keep up to date with changes in legislation and regulations. We get speakers to come in who are up to date to come and do the peer review processes, and even lecturers from universities who are looking at the latest material, teaching students. So there's a lot that needs to be done. But organizations, again, it doesn't matter when you're failing your regulations or your legislative duties. It's your responsibility to do the due diligence.
Yeah. I suppose the final point to touch on is, how does statutory and mandatory training align with CQC and regulatory inspections? So, because at the end of the day, this is what it all boils down to, isn't it?
Exactly. So think about the 5 key questions.
Yes.
That CQC ask, right? So organizations have to be safe.
Yep.
And what do you need to be safe? You need to think about safeguarding people. You need to think about health and safety, fire safety, all the so if you literally go through each of the 5 CQC questions, and then say, look, what do I need to do to meet this?
Yeah.
But again, people don't take time to do that. They want a list.
They want a list.
And a tick box.
Yeah.
Right. But the better organization, or the organizations that do better, in fact, actually, the better organizations do that. There are some companies that I won't even worry about naming. For example, one of the best companies that I worked with that understood that mission was One Health. The guys in Sheffield.
Yeah.
They've gone on to become one of the largest private providers of healthcare in this country. But those guys, I remember Andrew and the team, they were fantastic to work with because they understood what needed to be done. They understood clinical governance. And they built a fantastic business, which was then acquired in the end. But for me, it's an example of how to do things.
Yeah, it's a good story. Yeah.
It's a fantastic story because when we went in, there were quite a few gaps. Then we worked together and refined. By the end of the second year, we were pretty much up to date with everything.
Yeah.
And then it was now actually a matter of going for outstanding.
Yes.
What do we need to do to innovate? What and for me, that is
breaking
barriers
down.
It's a joyous sort of experience. One of the best clients that I've ever worked with. There are a few others, obviously, but that to me, they understood literally every single element of the regulations and every single element of the 5 key questions. How are we going to meet that? So you're matching.
Yeah.
This is the requirement. How are we going to meet that? This is the requirement. Who needs to do it? Even the admin staff. I remember their compliance manager at the time would work with the reception team, customer service team, the bookings team, the clinical teams, and even the host hospitals that they were working with. We actually took best practice from them into those hospitals where they were working because they were taking whole theaters in hospitals to run theaters and recovery rooms. It was fantastic to do that. How to do governance and compliance properly.
Yeah. Okay. I think, hopefully everyone's found that interesting, maybe learned something new or something they should know. Like I say, if anyone has any questions, feel free to add some comments. We're always keeping an eye on any engagement on the social media channels, but you can also contact our team. And we'll also be discussing this in some of the upcoming newsletters, I think, as well. Because it's always a hot topic.
And if people have questions, they can send us questions. We're happy to be driven by. In fact, most of our conversations we get them from our customers.
They're customer-led anyway,
And our client relationship managers, they ask us questions, and we think, oh, okay, this is a frequent question. Let's address it. So we're going to be doing more and more of that throughout the year. Every week we'll have conversations. So we'll write some blogs, post on LinkedIn and Facebook. But I think these video conversations are important. The podcast is important as well. And one of the things we're going to be doing is we are talking to a few people, for example, CQC inspectors, former CQC inspectors, people that are running, some of them, they may seem like competitors to us, actually, but we look at more as, they're in the field with us. There's certain things that they're doing very well. It's good to invite them onto our podcast and talk to them.
Definitely.
And collaborate more because actually if we learn from each other and share experiences, for us actually it's worthwhile to do it that way.
Well, even from our side, it's about offering a better service and how we can help people. That's why we're doing what we're doing in a way. Yeah. Okay. I hope everyone has a good weekend, and we'll see you next week.
See you soon. Have a good weekend.